This is Erin speaking. How can I help you? 3 victims of a house fire. 2 adults, 1 infant. What's the percent of burns? 18% on the dad. What about the wife? Unconscious. Okay. Is the baby stable? Stable, vital signs, no distress. Okay. Do you have any IVs started? What's the gauge on the father? Father's a 17 and woman is the same. Okay, we have Bay 1, 2, and 3 open. Make sure you take the dad to Bay 1, and I will call the burn unit to come get them and call a doctor and meet you in the room, okay? Thank you. Dr. Jones, it's Erin from the ER. I just got a call about 3 victims in a house fire. There's 2 adults and 1 baby. The dad has 2-degree burns on his arms, about 18% they said, and the mom is unconscious. The baby has stable vital signs. There's wheezing, coughing. I set him up in Trauma Bay 1, 2, and 3, so if you want to meet us down there, the estimated time of arrival is 10 minutes. Thanks. It's Erin from the ER. We have 3 suspected burn victims, and they are in Trauma Bay 1, 2, and 3 here in the ER. Can you meet us down there to see which one should go to the burn unit? We know the dad for sure has 18% of his body filled with burns, but the other 2 we're a little unsure. Can you meet us down there? Thank you.
Hi Chuck, my name is Sarah. I'm here to take your vital signs for you.
Hi Chuck, my name's Christy. How you feeling?
Not so good. My arms are hurting.
Hurting pretty bad?
Yes, ma'am.
Like on a 0 to 10 scale, how bad is it?
13.
And like what kind of pain are you in?
Because it's burning.
I'm just gonna listen to your lungs, okay? Take deep breaths for me. He has some wheezes in his bilateral lower lobes. Can you feel me touching you? Can you squeeze my hands at all?
A little bit.
Okay. He has 30 pulses. Bilaterally, upper and lower extremities. Can you feel me? Can you push against my hand? Okay. Do your feet, legs hurt at all?
Not really. My arm.
No swelling? Okay.
How you doing? My name's Dr. Jones. I'm the doc here in the burn unit. Can you tell me your name?
Yeah, Chuck Williams.
Chuck Williams. What happened to you today here?
My wife was cooking, and next thing I know, the house was in smoke.
It looks like you got some thermal burns here. What percent would you say those were?
18%.
18%.
Second-degree burns.
What were his vital signs?
His blood pressure was 90/52, heart rate was 110, respiration was 30, and his temperature was 98.8.
What were they when you came in?
His blood pressure was 110/60, heart rate was 85, temperature was 98.2, and his respirations were 28.
I'm going to take a look in your mouth here real quick, sir. Alright, looks like he's got a little tracheal edema. Nothing I'm worried about right now. We're going to want to monitor him, that edema for 72 hours, and we're going to want to be ready to intubate him. Do you understand what that means, intubation? It just means that we're going to have to put a tube down your throat if your airway continues to swell.
Okay.
Did you hit your head or fall down during this
No,
at
I
all?
don't think so.
No? Alright. I'm going to go ahead and take a listen to your lungs real quick. Give me a nice deep breath. Alright, I do hear the bilateral wheezes. We do have them on 100% non-rebreather. Okay. What type of room were you in when this happened?
Oh, I was in the living room.
Living room?
Yes, sir.
Alright. All the pulses good?
They're ready.
Pulses steady?
But they're present, yes.
How's the skin? We warm, cool,
Warm right now.
warm?
Yeah.
Alright. So since you have some burns here on your arms and your clothing looks like it got a little melted, we are going to have to remove that in surgery. We don't remove that here. We're going to give you a pain med to help relieve some of that pain. We're also going to give you that around the clock, so you should be a little more comfortable. We're going to give you Ativan for the anxiety. Do you have any questions for me right now?
Yes, sir.
All right, I'm going to give you guys some orders. We're going to get some humidity on that O2 supply. I'm going to need a Foley cath in because we're going to want to monitor that output. We're going to DC this field IV. Looks like you guys have lactated ringers running at 125. I'm going to need 2 17 gauges for all the fluid he's going to be getting. And as far as the fluid, we're going to use the Parkland formula, which is going to be 4 milliliters lactated ringers times the 18% body surface area times the patient's weight in kilograms. What was his weight?
100.
100? Okay, so that's going to come to 3,600 mLs within the first 8 hours, and then the second 16, I need another 3,600 mLs. All right. We're going to need an order for the Ativan, an order for the morphine. I'm going to need a clean catch on the urinalysis. We're going to look for myoglobin in the urine from the breakdown from the burns. It can cause kidney failure, so we're going to really want to watch that. I'm going to need a chest x-ray. We're going to take a look at those lungs, see what they look like. I'm going to need a CBC, the CKMB for the myoglobin, ABGs, and we're going to type and cross him as well because we may need to transfuse. And we're going to keep him NPO for the surgery as well. Do you guys have any questions?
No, I don't believe so.
All right, I'm going to put those orders in and you guys get started on those, okay?
Okay.
I'm just going to clean your wound with some sterile cleaning.
Okay.
All right, Chuck, I had to DC the IV that came in when you were on EMT. I'm going to have to put another one down your leg, okay?
Okay, sounds good.
This one's going to run your normal saline. And we're also going to put your morphine and your Ativan through this one, okay?
Okay.
All right, try not to move your leg too much, okay?
Okay. Do you guys know anything about my family?
We will find out as soon as we can. They're getting treated themselves. You should
Okay.
just focus on you right now.
Okay.
Hello, Dr. Smith. What do we have going on here?
Hi, Dr. Smith. This is Candace Williams. She came in from house fire. Her husband and her daughter were there with her. She came in, singed eyebrows. There's bilateral bronchi. Pulses are good. Her baby's in the next room getting assessed right now. Her husband had 2-degree burns. He was sent to the burn unit.
Blood pressure was 118/92. Pulse was 98. And her temperature is 98.3.
Since she has Syngyra, we're going to suspect inhalation burns. How's her airway looking?
She has a little bit of tracheal edema right now, but we have her on the 100% humidified oxygen. We'll just continue with that and monitor it over the next 48 hours, see if there's any changes.
Okay, since she is unconscious, we need to see if she has any carbon monoxide poisoning. And so we're going to need a carboxyhemoglobin level, a CBC, an ART stick, and when she wakes up, we need coughing and deep breathing exercises taught to her, turn her every 2 hours, suction as needed, and keep meticulous pulmonary hygiene. And we're going to do frequent respiratory assessments on her. Okay. All right, do you have any questions? No. Her labs are back. We're going to transfer her to the ICU. Her carbon monoxide level was a little elevated, and so we'll need to watch her airway, but we won't need to intubate her. So there will every 4 hours we're gonna do ABGs. So any questions?
No, I'm gonna call the ICU and tell them to come in.
Okay.
You wanna check respiration as well? Check her blood pressure?
Yes.
Get the apical too.
Hi, I'm Dr. Smith. I'm the ER doctor. Hi, doctor.
Hi, Dr. Smith. This is baby Williams. Baby, the mother next door came in with the fire. She seems stable. Her blood pressure is 90/55. No evidence of burns or anything.
Respirations are 50. She just has some audible wheezes and a little bit of a cough. Her heart rate was 120.
Yeah, we'll take a listen. Okay. She clearly does have audible wheezes, and just take a good look at her. I don't see any burns, so I don't see a reason to send her to the burn unit. She's stable. We do have the equipment here to treat her. So
Okay.
let's put her on 50 milliliters low flow oxygen and just monitor her vitals.
Okay.
Okay. All right. Thanks, Doc. Thank you.
How you doing today, Chuck?
Not too bad. Ready to go home.
Remember me? I'm Dr. Jones. I'm the burn unit doc.
Right.
Just going to talk to you a little bit about your discharge here. You're going to have some pretty itchy arms here the next couple weeks and months. It's really pertinent that you don't itch to prevent a lot of potential complications. As far as your diet, we're going to keep it increased 5,000 calories a day, heavy in protein and vitamin C, just to promote the healing, give your body the nutrients it needs. Continue to take your antibiotics. We don't want you to be back in here with any infections or anything like that. So basically the acute phase of this process is over and we're in the rehab phase. You're going to want to continue to wear those splints. We don't want any contractures. We want to keep your arms moving. We need to talk to you a little bit about how you're feeling about the whole situation as far as your feelings. You're going to have a little bit of a different skin than you've had. Do you have any anxiety about that? Have you been having problems sleeping?
I'm a little anxious about how people might see it, but for the most part, I'm okay.
That's understandable. I can refer you to a few different, I could refer you to a psychologist. There's also a program called the Phoenix Program, the Phoenix Society, which helps burn victims. So we'll look into that for you. And your feeling towards this is just as important as how well you've healed up. So, any questions for me?
No, sir. Sounds good.
All right, I'm glad I could help you out.
Yeah, my wife was cooking, and the next thing I
His
know,
blood pressure is 90/52.
house was filled with smoke.
That's scary. How you feeling?
Other than the pain, not bad.
Is that family?
Can you tell me your full name?
Chuck Gutierrez.
Not that.
Okay.
Here I go. Ready?
How's your mom? What am I telling this to these people? What else do they need to know?
They have to meet us there.
Oh, they're coming to
They're
get
coming
them.
to
Tell
get-
them
no.
to meet us at
Tell them
phase
to
one,
meet us
so
there, and
accompany
that's it.
down us to the bracket.
That's
That's
it.
really all it is. You're doing great.
I'm so sorry. I feel like Abby. Okay, let me just try one.
So I see.
What's his name?
Jones?
Chuck?
You're,
His. Yeah,
you're
his Chuck.
Dr. Jones.
Dr.
Chuck Williams.
He's Chuck
Can I
Williams.
shake your hand when you walk in the room?
No.
I want to touch you.
Don't touch